So she told me what I was diagnosed with, and at first it was a little scary. You know, one of my first questions was, will I be able to play high school baseball, which I worked really hard for. I also wondered, will I ever be able to be a firefighter, which is my dream.
Hello Dragons, my name is Sarah and these are my fellow co-founders Brendan and Alicia. Thank you very much for having us here today. We are representing J.A.W.S, Juvenile Arthritis Water Sharks, and our passion is improving the quality of life for children suffering from juvenile arthritis, or JA, through our structured aquatics programs.
JA affects 4 out of every 1,000 children. It is a long-term chronic condition in which one or more joints become inflamed and causes limitation in joint mobility, resulting in a significantly decreased quality of life for this population. According to the Arthritis Foundation, JA is commonly diagnosed when a child under the age of 16 presents with joint pain and a limp and/or swelling in one or more joints for at least 6 weeks.
JA can go into remission. However, the more common course of action is for it to develop into adult arthritis. According to Helmick and colleagues, adult arthritis is a leading cause of disability and is among the primary conditions causing work limitations. Arthritis reduces people's occupational and participation abilities, as well as causes severe pain and decreases one's functional abilities. Also, CBC News states that arthritis, including JA, costs the healthcare system $33 billion a year via direct and indirect costs.
Currently, JA is underreported and the diagnostic processes and available treatments are inconsistent across medical professions. To reduce the social, economic, and health burdens that arthritis puts on society, we must shift our focus to the early onset of arthritis and hopefully cause improvements in the pain, balance, and gait impairments experienced as a result of JA.
J.A.W.S is an aquatic therapy intervention delivered as modified group swimming lessons, organized into classes by participant age. The program offers graduated levels designed to challenge each age group with weekly progressions in intensity and difficulty of activities or movements as the participant's skills increase. Each level spans 8 months in which the participant will attend hour-long classes twice a week. As previously mentioned, the program consists of graduated levels and is expected that the participant will return to continue the treatment and complete the next progressive level. Children can advance based on age or upon instructor recommendation.
J.A.W.S has the goal of improving its participants' range of motion, gait, balance, and functional mobility. All children under the age of 16 presenting with signs or a diagnosis of JA are eligible. However, participants must have a physician referral to register. We are asking for $2.5 million for 50% of the company to help us take our initiative to the next level. The funding we are seeking will go towards covering the costs of training for our 5 instructors to facilitate the classes, estimated at $250 per instructor, to increasing public awareness through advertisement and promotion of the program by launching a $30,000 media campaign, as well as for the purchase of some of the more elaborate equipment necessary to administer many of the treatments.
Underwater treadmills cost roughly $4,000 each, and we would like to start with around 10. Construction of the custom rehabilitation pool has been quoted to cost $100,000, excluding building lease fees. The current market in Waterloo, Ontario suggests that a building large enough to accommodate this operation, such as the Waterloo Memorial Recreation Complex, would require approximately 1,000 square meters and lease for approximately $195 per square meter, which can be extrapolated to almost $2.3 million for 10 years. Registration for J.A.W.S will cost each participant $320 per 8-month session, and we would like to subsidize 20% of those costs for first-year registrants, so their fee is reduced to $256.
Classes are individualized to participants' needs, and trainers are required to complete an aquatic instructor's course offered through the local Arthritis Foundation. Classes are designed to include a 15-minute warm-up phase of slow static stretching and lower extremity joint motions in all planes, a 30-minute workout using underwater treadmills, resistive jets, and parallel bars, and 50 minutes of free play and class water games.
Studies have reported aquatic exercises performed in a group setting have shown to be an enjoyable and beneficial part of therapy for children with arthritis. The water setting decreases stress and load placed on weight-bearing joints and allows for increased movement. Research performed by Bacon and colleagues implemented a similar aquatic program, and that therapy resulted in significant increases in the range of motion in lower extremity joints and a slight improvement in the cadence and stride length of participants' gait. Lower extremity range of motion was measured before and after aquatic exercise. Increases of a minimum of 10 degrees were observed in hip and knee flexion, hip rotation and extension, and ankle plantar flexion. Gait changes occurred with an increase in cadence by 12 steps per minute and improved balance through an increase of 2.4 seconds in length of a left leg balance test.
We are very dedicated to this cause. Indirectly, we would like to see this program assist in raising awareness and funding for juvenile arthritis research.
Our aim is to help the children suffering from arthritis pain to live a better quality life and reduce their overall impairments so that they can eventually participate fully in the same activities as children without the burden of juvenile arthritis. Thank you, Dragons.